Selamat pagi. Welcome back to another Bali COVID-19 update for January 30th, 2022. And my name is Bruce. Lots of news today, including a couple of interesting, intriguing stories that have everybody talking about on the internet, especially the news that Singapore Airlines is starting flights to Bali coming in February. And the president addresses the country about the surge in coronavirus cases. And so those are the two main stories. And what is the weather today? The wind speed is 1 kilometer per hour. It is absolutely dead. Very unusual here to have no wind at, it's 9:30 in the morning. And the humidity is 78%. And the temperature here in Kampung Bugis is 30.7 degrees Celsius. Let's get started and take a look at the numbers. The numbers are not looking good. And well, this was expected. Everybody talked about there's going to be a surge after the holiday period. And sure enough, there is. And it is a big one. And it's building up. And we still have a ways to go before we get to the peak. What are the numbers? 7-day average for new positive cases, 166. 7-day average for deaths, 1.1. Let's take a look at 2 weeks ago on January 16th. What were our numbers then? The 7-day average then was 9. Numbers were just starting to go up at that point. And so 9. And today we had 166 and deaths were 0.3. And so that's the comparison. What about yesterday nationally? Nationally, new positive cases, 11,588. Deaths, 17. So deaths are going up some, but not as quick as the new positive cases. And what about 2 weeks ago? 2 weeks ago, nationally, we had 1,054 cases and 4 deaths. And so, wow, the number of cases has exploded. We are in the third wave, as a segment coming up talks about. What about testing in Indonesia yesterday? 261,050 people were tested with a 4.44 positive rate. The 7-day simple average positivity rate is 2.97. And 2 weeks ago, the 7-day positivity rate, 0.38. And that positivity rate is going to go up and up. What about testing in Bali? Bali tested over the last 7 days 47,477 individuals with a 7-day positivity rate of 1.86%. 2 weeks ago, 0.14%. So numbers going up here too. And vaccinations being pushed all over the country. Yesterday, 3,900,673, 86.3% of the population. Second doses, 3,457,146, 76.5% of the population. Yesterday, an additional 8,490 doses were administered in Bali. And what about the Bali numbers for January 29th? New positive cases, 325. Deaths, 1. Good. Active cases, 1,292. How long has it been since we've seen active cases in 4 digits? And 2 weeks ago, new cases, 7. Deaths, 2. Active cases, 99. So those numbers are not looking good, but they were expected. And as you'll hear in segment after segment, the government says, okay, the numbers are surging, but everything is okay because this is milder. The hospital situation is okay. Bed occupancy rate is okay. Don't panic, as the president says, and that will be coming up in just a minute. But the first main story is going to be about Singapore Airlines restarting flights to Bali in February. So let's take a look. At this point on this Saturday afternoon, this looks like to be the main story because it is everywhere on the internet right now. Singapore Airlines to restart services to Bali. Yes, that's right. This is an official announcement, not a rumor. Singapore Airlines will resume commercial flights to Bali from Singapore to Bali and Bali to Singapore starting on February 16th, 2022. That's right, less than 3 weeks away. SIA will operate a 337-seater Boeing 787, B787, 10 aircraft on this route. And, well, everybody is excited. This is just everywhere on the internet this morning, and I received emails about this as well. What else do we know? No details right now. We're going to have to wait for the details. What does this say? Singapore has announced before that they're coming, and then they had to cancel. And as many of you know, Jetstar and many other airlines have announced flights to Bali and had to cancel. Well, this is some good news if it's actually true. But there are questions since there's no details. And one is, what's going to happen with the quarantine? Is the quarantine going to stay the same, 7 days? Will it be dropped to 5, to 3, to 1? No quarantine? That's not known yet. Will a VTL be in operation? Or what about a travel bubble like with Batam that I talked about in the video here? Does Singapore know something that nobody else knows yet? Have they talked to the government about this and they have some kind of arrangement? That's not clear either. There are hotels in Bali ready to quarantine people if the quarantine is going to be in effect. What kind of visa will be available? Right now, you can only come into Bali if you have a B211 tourist visa, and is that going to be changed before then? There's a lot of questions, and so maybe there'll be some new news by the time I post this tomorrow. We'll just have to wait and see. But this is good news. People could fly into, theoretically, people could fly into Singapore from, say, Europe, and then hop on a flight to Bali and get to Bali and do your quarantine there if the quarantine is going to stay in effect. Is this going to be the start of international tourists arriving back in Bali? And don't forget that coming up, there are a lot of segments here about the virus, and Bali numbers up to 311. There are a lot of questions. I'm thinking positive here. Let's think positive. But what do we have coming up? We have the MotoGP in March, so maybe this is related to the MotoGP. And, well, you know, the MotoGP had some problems with the travel bubble scheme, so is there going to be some changes there? We're just going to have to wait and see, like always. And one of the main stories, the president, yes, the president, has issued a statement about the spike in the coronavirus cases, the Omicron variant. Now, you know, usually this is something that Pak Luhut does, but the president at this point has come and made an announcement himself. So this shows how seriously the government is taking this. President Jokowi explained that the transmission of the Omicron variant is going to increase over the next few weeks, and he asked the entire community not to panic and to follow the health protocols. The president said the government is prepared. They've prepared health facilities and facilities that have been adapted to the character of the Omicron variant because, according to him, Omicron variant has a different character than the other COVID-19 variants, as we know. And the president said, improvement of health facilities infrastructure is adjusted to the character of the previous Omicron variant and requires different handling, one of which is through telemedicine services. Wow, okay, didn't know we were using telemedicine services. The president also asked people that were exposed to the Omicron variant to self-isolate for 5 days if they did not experience severe symptoms. He said, when your PCR test results are positive without any symptoms, please self-isolate for 5 days. If you have a cough, runny nose, or fever, please use the telemedicine services or go to the nearest puskesmas or doctor. Ladies and gentlemen, stay calm. Don't panic. Always implement health protocols, reduce unnecessary activities. Now, the president's speaking, we assume that the numbers are going to continue to shoot up. This is Saturday afternoon at 1:30 p.m. So let's see tomorrow at this time how many. So almost 10,000 today. I forget what the exact number was, 9,000 something. We'll see. So the third wave is here. And how is that going to fare for us in Bali? We'll just have to wait and see. And some more on COVID-19, and the third wave has hit Jakarta. In Jakarta, 80% of the population has been vaccinated already, and on Thursday, the country saw 8,077 new confirmed cases. That was the highest official daily caseload since August of last year, when the country was struggling to contain the Delta-induced second wave, which peaked at 56,000 cases a month earlier. Jakarta has seen an increase in hospitalizations as cases begin to soar again, triggering calls for the government to tighten curbs and put a brake on in-person education. The capital's COVID-19 bed occupancy rate, the BOR, increased from 8% on January 3rd to 38% on Wednesday, according to the Health Ministry. And the BOR nationwide is 10%. How bad is this getting in Jakarta? The Social Affairs Ministry building in central Jakarta has been put under lockdown until at least January 31st after 60 of its workers tested positive, while 90 schools in Jakarta have been closed after their students and teachers who just restarted in-person learning have contracted the virus. Health Minister Pak Budi told a press conference on Thursday he's confident that Indonesia will be able to control the third wave, arguing that Omicron, which is believed to be the culprit behind the surge, is milder and thus less likely to overwhelm the nation's healthcare system. An expert staffer at the Office of Presidential Chief of Staff released a statement asking asymptomatic patients to isolate at home, claiming that some Jakarta citizens have found it difficult to access hospital services. Pak Budi said that the government will ensure that only those with moderate and severe symptoms will be hospitalized and that it would prioritize vulnerable people. Furthermore, he added that the government is still able to increase the number of hospital beds from current 80,000 to 130,000 if deemed necessary. And the minister added that for Omicron, it's important to focus on the national pandemic strategy of the hospitalization rates. He said, going forward, we will focus our strategy based on hospitalization figures. Even if daily COVID-19 cases are around 7,000, like now, actually, yesterday it was 9,000, we will take into consideration how many of those are hospitalized. And the head of COVID-19 task force at the Indonesian Medical Association has called on the government to suspend in-person learning and raise the level of public activity restrictions, which currently remains at level 2. He said, with daily infections soaring past 7,000 and the positivity rate going past 10%, these are indicators that in-person learning is no longer safe. He said, please consider calls to cancel 100% in-person learning and raise the public activity restrictions level, the PPKM. And according to Masdalena Payne, talked about her many times from the Indonesian Epidemiologists Association, she said some people might have little option but to isolate themselves in hospitals, even with mild symptoms, because their houses are not suitable for independent isolation. So you think about a house where you've got 4 or 5 people in these little tiny houses, like one I used to live in, 36 square meters I think we had, and if you've got 4 or 5 people there, there's no space to self-isolate. She urged the government to mobilize neighborhood units to provide isolation centers, particularly for densely packed neighborhoods, in collaboration with the Puskesmas, community health centers. She said those local task forces can repurpose unused buildings as independent isolation centers with medical supervision from medical workers at the local Puskesmas. Therefore, people with mild symptoms will not drive up the country's BOR figures. More on coronavirus in Indonesia. COVID-19 case surge. Task force requests regions to monitor health protocols. According to Pak Wiku, and he's in a lot of these today, he said, we've asked the regional task force, public facilities, and transportation management to strictly discipline people in wearing masks and avoiding crowds, because hearing over and over again from various regions in Java, in Bali, that people are not masking up anymore, or they're doing the chin mask. Social distancing, well, as I've said since this started, social distancing just ain't happening. So we're in a surge. And what's the government going to do? Well, we'll find out in just a minute. Pak Wiku said that if cases continue to rise and are rampant, the government will consider restricting mobility. Okay, and what does that mean? That means going to another level, going to 3 or 4. Because on Wednesday, Indonesia had 7,000 cases, almost double the previous day. And so the numbers are shooting up, and here in Bali as well. I'm doing this on Friday, and numbers in Bali yesterday up to 212. And so our numbers are shooting up. And why? Well, we'll talk about that in another segment. According to the task, my mouse is took off. This is how the wind is up here. It's just so unpredictable. According to task force data, Jakarta has become the #1 region with average daily cases 3,509, followed by West Java and Banten with 1,619 and 1,113 cases, and other regions are going up as well. East Java, Bali, Central Java. So numbers are rising, and it's quite possible that they're even higher than being reported because of lack of testing in some places and people who are just not going in to get tested. And so as Jakarta has become #1, what's happening there? Well, health agency clarifies why Jakarta yet to pull COVID-19 emergency brake. The Jakarta Health Agency said that the governor doesn't need at this point to pull the emergency brake because with the addition of daily infections still within safe limits, including the occupancy rate of hospital beds and ICU, things are still relatively stable. According to the agency's head of disease prevention and control, Dwi Octavia, we see that the current situation can still be under level 2. That's PPKM level 2. Dwi explained that the current ICPU occupancy rate was recorded at 14%, hospital bed occupancy rate at 45%, and she argued that the figures were still safe since the alarm limit is 60 to 70%. If the government waits until it's 60 to 70%, is that going to be too late with the numbers shooting up the way they are? I don't know. I'm not a doctor. And according to Dwi, emergency brake will be taken when the occupancy rate of isolation rooms, the occupancy rate of hospital beds, and the number of cases become unstable. Are they stable at the rate they're increasing now? I don't know. We'll just have to wait and see. This is Friday. Who knows what's going to happen by the time I upload this on Sunday. And Dwi said, besides public activities, perhaps we've already known that it's difficult to control the public discipline, health protocols, and others. And so this is becoming a new refrain again. Was a refrain a long time ago and is coming back again as cases spike up. Government officials complaining that people are not taking this seriously, that they're not wearing a mask, that they're not social distancing. Is that true? Quite probably. From my observation with the Peduli Lindungi app, I've only been to one place that's used it. I've been to 4 places now that have them, only one that's actually asked me to use it. Other places I walk by, I kind of pause, hesitate to see if they're going to ask me to pull out my phone and do a scan. They take my temperatures a couple of places and pass me on. And what's happening with the Omicron variant in Indonesia? Government advises to take COVID-19 tests once flu symptoms arise. Yes, because the flu symptoms are similar to Omicron symptoms. And so a lot of people are not going to get tested. They figure they've got flu. And well, that's happening right here. My granddaughter last week had flu symptoms, went to the doctor, full of kids here. And the doctor said, it's flu season, don't worry about it. It's not COVID. Did they test anybody? No. With our numbers going up here in Bali, it's quite possible that the numbers are a lot higher than the government is actually counting because of people who are sick but are not going to the hospital. And so that's what this is about. So this government advisory comes after health authorities found that symptoms of Omicron are similar to symptoms of flu. And according to Dr. Tarmizi, Dr. Siti Nadia Tarmizi, who we hear from a lot, she said people should immediately take the test once they feel a change in health. She said the symptoms of Omicron are generally less severe than the symptoms of Delta, and, well, we've heard this story before. And according to the spokesperson for the COVID-19 task force, Wiku Adisasmito, he said that even though the symptoms are allegedly milder than for the Delta variant, people need to remain alert and follow existing health protocols. And we hear this over and over again. Are people doing it? I don't know. And some more on what's happening with Omicron cases in Indonesia. Gap between local transmission, imported Omicron cases narrowing. So originally, the imported cases were way higher than the locally transmitted cases, but that's changing. According to data provided by Jakarta's health office, as of Thursday, the number of Omicron cases has reached 2,404. And these figures comprise 1,309, or 54.9%, imported cases, and 1,095, or 45.5%, locally transmitted cases. These figures much different from Tuesday, when Tuesday 68.7% were imported cases and locally transmitted cases were 31.3%. So what does that mean? Well, it means that we're spreading it among ourselves here. In view of the spike of Omicron infections, the Jakarta provincial government has asked residents to follow health protocols, which constitute wearing a mask, maintaining distance, washing hands, reducing mobility, and avoiding crowds. And Jakarta's governor has issued Governor's Decision number 59 of 2022 on PPKM, Public Activity Restrictions Level 2. And this decision restricts the number of people's activities. For instance, the non-essential sector has been allowed to conduct work from office, but only for vaccinated employees and at 50% capacity. Meanwhile, the essential sector has been allowed to operate at 50 to 75% capacity, and the critical sector at 100% capacity. However, work that can be done at home should be done at home. And what's happening in Thailand? Phuket seeing 500 cases a day. Roughly 1/4 of these 500 cases are coming from tourists, according to the provincial public health chief. Out of every 500 cases on average, 380 are local and 120 are from international arrivals using the sandbox and test and go schemes. The island is welcoming 3,000 to 5,000 tourists a day at present. The island still has plenty of hospital beds available for people with COVID-19, as those reserved for patients in critical condition are only 10% occupied compared to 65% for those with moderate symptoms. About 1,900 people who've tested positive are in home isolation as they don't have any symptoms, and over 88% of the people in the province have received their first vaccination shot, while 85.5% have had 2 jabs, 55% have received a 3rd shot, and nearly 10% have received 4 shots. Wow, okay, I didn't know they were doing 4 shots. Meanwhile, PHRI Phuket Hospital is providing PCR tests at 1,300 baht per test for infected patients who need the lab results to quarantine at hospitals. And in other places in Thailand, the Chonburi Tourism Councils joined hands with the Pattaya Business and Tourism Association, Hotel Associations of the Eastern Region, and 8 other tourism agencies to provide rapid COVID tests free for the 6,000 Thai workers in the service sector. The goal is to mitigate the transmission of the disease and ensure tourists of their safety while traveling in the province. And meanwhile, in Rayong, a group of visitors canceled a trip to Koh Samet yesterday because they learned that they had to pay a 330 baht fee for a rapid test, as they did not have a valid test result conducted within 72 hours of boarding the ferry for the island. And according to a tour operator, she said she took 10 Swedish tourists there. When they got there, they were asked to show their test results. They didn't have them, and they were told they would have to pay to get them done, and they turned around and left. The ferry owners said that after the province announced the requirement on January 20th, many tourists have decided not to visit the island because they're coming for a one-day trip and they don't want to go through the hassle and expense of having another test, even though they already have been fully vaccinated and tested when they got into Thailand. So that's a lot of cases in Phuket, but they're staying open, and so we'll have to see what's going to happen here. Okay, I had to come down from the roof. It was just too windy and too sunny up there, and so I'm back down in my room. And what is happening in Bali? Denpasar City Government received 2,550 food packages from South Korea. Okay, thank you, South Korea. So the Denpasar City Government received these packages from the South Korea Science Development Foundation, along with the South Korea Dongan Church. And those are to be distributed to residents affected by the COVID-19 pandemic. The basic food packages are intended for residents exposed to coronavirus outbreak, including underprivileged residents, people with disabilities, abandoned children, neglected elderly, and socioeconomic vulnerable women, widows with no income. The chairman of the South Korea Science Development Foundation said that this Assistance is a form of sympathy and concern from the people of South Korea to the Balinese people, especially the people of Denpasar. The basic food packages consist of 5 kilograms of rice, 1 kilogram of sugar, 1 liter of cooking oil, and 5 packs of instant noodles. The chairman said that this momentum is a form of collaboration between the Bali Science Foundation, which is also working with the Dangan Church, located in South Korea, to help the people of Denpasar. He said with this activity, his hope the South Korean brotherhood with the Balinese people, especially Denpasar City, will be closer. And the mayor of Denpasar, Jayad Nagara, said that he was grateful to the Bali Sciences Foundation and its ranks, including Dangan Church, located in South Korea, for providing assistance to the city government and the people of Denpasar. And more on Bali. PHRI asked hotel and restaurant entrepreneurs not to immediately lay off workers. So the chairperson of the Indonesia Hotel and Restaurants Association, PHRI, Badung I Gusti Agung Rai Surwijaya, said that the hotels do not immediately need to lay off workers, but that they can hire employees in rotation. Well, that is, use employees in rotation. He said that if the occupancy rate of hotels is low, his party wants the employees to be rotated at work so that all employees will feel the same fate and feel like they're being treated fairly. He said that he doesn't actually know the number of hotels that are laying people off or firing them immediately, but that his party will ask whether a company or hotel will be closed so that dozens of employees are laid off. So how many hotels are closing down for now? How many hotels are staying open but reducing employees by a lot? Those are questions that answers are yet to be finalized. And he said, with the ongoing problems that we have, it's hoped that there will be a right solution and that companies and employees can't accept it. So a compromise. He said, like this problem, the management of Hotel W, Bali Seminyak, has been summoned by the governor when the employees demonstrated. Even then, it is hoped that with a situation like this, there will be no hasty layoffs so that there will no longer be a social impact on the community. And so this has been an ongoing problem, and with the lack of tourists continuing and with, well, no immediate sign in sight of international tourists coming back, things are not getting any better. A few videos ago, I was talking about the Ogoh-Ogoh and Karangasem, and the Karangasem said that they were not going to follow the governor's permission to make Ogoh-Ogohs and parade them. Well, Karangasem head of culture and culture office troubled. Difficult to fulfill the Ogoh-Ogoh parade requirements. The head of Karangasem Culture Service is still confused about fulfilling the requirements for the Ogoh-Ogoh parade. Because of this, in Karangasem, there has not been a decision. The Karangasem Regency government, through the Karangasem Culture Office, will hold follow-up meetings to determine what they are going to do. The head of the Karangasem Culture and Tourism Office said that, in principle, they agree with what the governor said. However, there are at least 11 items that are required in order to have the Ogoh-Ogoh parade, and one of them is enforcement of health protocols, such as limiting participants to a maximum of 50, conducting rapid antigen tests, and being free from COVID-19. And according to a spokesperson, this should be a guide for the community. We neither prohibit nor confirm, but we appreciate the opportunity given to the younger generation. However, with these requirements, he said that it's difficult for the community to hold the Ogoh-Ogoh parades. Because of the pandemic, or the Omicron variant, which is expected to explode in February and March, this is going to be difficult because it will coincide with Nyepi. And he said, additionally, the financing of the manufacture of Ogoh-Ogoh usually receives financial support from the community. But at this point, because things are so hard, they don't want to ask the community, the public, for money when they're struggling to get by. And at this point, nothing is firm in Karangasem for holding the Ogoh-Ogoh parade, for making the Ogoh-Ogohs. And I haven't heard anything yet about Bulalang. I've been looking for news about this in the Bulalang news sources and have not seen anything yet, nor have I seen anybody making any Ogoh-Ogohs yet. And more on Bali. According to this article, Bali Task Force increase in COVID-19 cases due to massive tracing. The Secretary of the Bali Province COVID-19 Task Force, Made Renton, and we've heard about him many times over the last 2 years, said tracing and testing are optimized and some positive cases of COVID-19 are asymptomatic. Still no word on whether we have the Omicron variant here. So on Tuesday, Bali had 96 cases. Wednesday, 212. The case distribution in Bali on Tuesday was Jembrana 11, Tabanan 15, Badung 26, Gianyar 4, Klungkung 9, Buleng 8, Denpasar City 23. So of course centered down in the high population areas. He said the dominant cases are travelers, and there are also a number of students who have been confirmed to have COVID-19 with no symptoms. He said that despite the increase in positive cases, the majority were asymptomatic and there are only a few people that have been referred to the hospital. He said most likely it's because the immune level is already good, so although exposed to COVID-19, the symptoms are not severe and even without symptoms. What do you think he reminded the people of? Yes, be disciplined in the health protocols and immediately follow COVID-19 vaccination. The acting head of the Bali Provincial Health Office asked students to remain disciplined about healthcare when outside of school. He said, at school there must be discipline, but it's not guaranteed when you come home from school because you can stop by here and there, get together, and other things. And some more on Bali, and this time, Pak Jokowi. Pak Jokowi looks to bring in prominent figures to Bali's G20 summit. So Indonesia is expected to hold the G20 summit in October in a slightly changed format, with more emphasis on bringing in prominent figures to speak, rather than just politicians. According to Communications and Information Ministry Director General of Information and Public Communication, Usman Kansong, the president is planning to invite innovators, philanthropists, and business leaders to take part in the summit, which is scheduled to be held in Bali. Yay. And which elites are going to be here or be invited? The president plans to invite some prominent figures such as Bill Gates, Mark Zuckerberg, and others to speak at the events. According to Pak Usman, political leaders come and go with each election cycle. I like that. But these people have been dedicating a significant part of their lives to advocating for certain issues that they believe are important. Pak Usman added that by placing emphasis on more illustrious speakers from different backgrounds, it's hoped that the planned speakers could share their insights that would help the leaders of G20 countries tackle pressing global issues. And Pak Jokowi has told the World Economic Forum last week that Indonesia would push for a permanent solution to global health emergencies, including establishing an agency modeled after the IMF to manage global resources for future pandemics. He said that currently prevailing multilateral initiatives such as the COVAX facility were only temporary solutions, and the WHO has yet to play an important role in strategic aspects of our daily lives. And for those of you who don't really know what the G20 is, it is an informal group of 19 countries and the European Union. It was first formed in 1999 as an economic forum for financial ministers and central bank governors from member countries in an effort to find solutions to the 97 to 99 global crisis. That was bad, and it ended up being one of the reasons behind the fall of President Suharto and the rise of democracy in Indonesia. The forum was elevated to a leader summit in 2008 as group members convened in a bid to coordinate. It's been a while since we've had a foreigner behaving badly segment. Here is one. Foreigner angry after missing plane in Bali hits Avsec-Police. So a Jordanian national who apparently lives in Singapore went on a rampage at the airport the other day and hit 3 officers. The officers who were beaten were 2 Lion Air Aviation Security, those are Avsec officers, and a police officer. The foreign national, the Jordanian, went on a rampage at Gate 5 of the domestic terminal. And what happened? This was on Tuesday. So what happened? He was there and his family going home, going to Jakarta. I guess he wanted to go back to Jordan because his mother is gravely ill. And apparently they were sitting there and nobody told them that the plane was leaving, and the plane left. When he found out that he had missed the flight, he talked to some Lion employees who gave him answers that he found unsatisfactory, and he tried to enter the office to, well, carry his case further, I guess, and he was blocked by some Avsec officers, and a fight ensued, and he beat them, and a police officer intervened, and he was also beaten. So eventually, more police officers intervened because they didn't want things to get out of control at the airport. And the problem was finally mediated at the office, the Mapolsek office at the airport around 8 o'clock at night. The parties who mediated were the 3 victims and the Jordanian. After mediation, the 3 victims agreed not to question the beating incident any further, and they agreed not to take the case to court, the guys who were beaten. The Jordanian pleaded guilty and apologized to the 3 victims for the beating, and he said he beat them because he was overcome by momentary emotion. According to a spokesperson, the beating was carried out because he panicked that he could not go to Jakarta because the Lion airplane left him behind. Even though the plan was, after flying from Bali to Jakarta the next day, he would go to Jordan to see his seriously ill mother, as I said. So then he flipped out and started beating people. Okay, what is with people? Okay, it's time for the update and wrap up. And as I said, there's some interesting stuff in the update. Governor of Bali on the fast rate of COVID-19. Most likely Omicron. We have no confirmed cases yet in Bali of Omicron, but the governor says, yeah, most likely we have them. Samples have been sent out. They have to be tested in Jakarta, and so they're out, and we have to wait for the results back, but he's pretty sure that this is Omicron. He said most of the cases are asymptomatic or mild symptoms, and those who've recovered are quite high. Those who die are stagnant. That means that the risk is not too bad for people affected by COVID-19. Okay, and you hear this, you've heard this over and over throughout this video. Indonesia suspects Omicron already becomes dominant variant. So Indonesia's seen the uptake in the new cases over the past 5 weeks, and I was comparing them with 2 weeks ago at the start of the video, and it remains unclear the extent of the Omicron impact. The health minister, Pak Budi, said earlier this week that the government has limited whole genome sequence test, WGS, capability to determine if the current spike in new cases is caused by Omicron. He said there's only 12 laboratories in the country with WGS capability and a combined capacity of only 2,000 tests per month. And to make things complicated, the results are delivered in 5 days at the soonest. And he said, in comparison, we have more than 1,100 laboratories capable of conducting 300,000 to 500,000 PCR tests per day and delivering results within 4 to 6 hours. And so you see, it's hard to trace the Omicron to tell if the rise in cases is Omicron, but everybody suspects that they are because of the rapid way that this is increasing. Pak Budi said, by statistical method, results from WGS laboratories indicate that the Omicron variant may have accounted for 75% of recent cases. He said, I have a feeling that the majority of cases in Jakarta alone are Omicron. And some news from Australia, thanks to Kieran for sending this to me. I just saw this morning, Omicron subvariant found in Victoria amid race to vaccinate students. So state health authorities have detected a cousin of the Omicron variant in Victoria, believed to be more transmissible than the original strain. COVID-19 response commander Jerome Weimar revealed sequencing had detected a handful of cases of the subvariant known as BA2 in the community, but conceded not all positive results were being screened for it. According to Mr. Weimar, authorities are keeping a close eye on the subvariant overseas, but it's still too early to understand how it's moving around. He said, I'm aware there's a very small number of cases that have been detected here in Victoria, and our clinical teams are working through that. But at this point in time, this is an Omicron variant, so as far as clinical teams are aware at the moment, this is not a new variant. And according to clinical epidemiologist Nancy Baxter, head of the Melbourne School of Population and Global Health at the University of Melbourne, she said that the cousin of Omicron appears to be more contagious. She said, we're particularly seeing it in Denmark. We don't know if it's going to be a problem yet, but it looks like, if people can believe it, it looks like to be more contagious than Omicron. So if it gets here, it may extend our waves, so our wave may take longer to get out of. But we don't know enough yet, so stay tuned. Oh, she said something similar to me. Okay, everybody's saying stay tuned. And the wrap-up. With the third wave already here, questions about Singapore Airlines announcement. Are they going to keep the scheduled flight, or are they going to cancel it? Will people want to come to Bali if we're in the middle of a surge? So if Singapore does have their flight on the 16th and nobody shows up, what's going to happen? Or if nobody makes reservations beforehand, what's going to happen? Will the governor change the PPKM level now that we are in the midst of the surge? Will the government put a ban on incoming arrivals? And we should find out some more news about that tomorrow night when we get the usual Monday night announcement from the government about what's going on. So there are a lot of questions to be considered over the coming weeks. And the Singapore one, everybody is excited about Singapore Airlines. Everybody, even people that I know that are very cautious about saying things, as I am. It's like a ray of hope, some more light at the end of the tunnel. Oh, there's a plane going to come in. But we don't know anything about the visas. We don't know anything about quarantine yet. Are there going to be changes? So we're just going to have to wait and see. We're in the surge, and we're going to have to ride this out. And hopefully this will remain mild, and we will have a minimum amount of deaths and hospitalizations and people being able to take care of themselves at home. There is the video, the cooking video on black rice pudding. And if you found this video helpful, useful, informative, amusing, not depressing, please give it a thumbs up. And if you haven't subscribed, please consider subscribing. So as we wrap up January and head into February, it is going to be an exciting month. Be kind to someone today. Stay safe. Thanks for viewing, and I will see you on Wednesday.